Greetings to all. We welcome all the delegates for our conference on burns. So this day is going to be a very important day where we will be learning a lot of new treatment modalities for burns. So my topic will be skin tissue engineering, which will be one of the futuristic treatments which will be available to burn surgeons. Just before starting that, I wanted to know who are the people who will benefit from this lecture, who should listen to this talk. So if you are a young doctor, you will need this for your practice. If you are an old doctor, the knowledge about stem cells and regenerative medicine. So skin tissue engineering is part of regenerative medicine. So the knowledge about regenerative medicine is going to help yourself as well as for your family. So similarly, if you are a young scientist, you will need this for your PhD, and you will need this for your further progress. If you are an old scientist, you will need these regenerative treatments for your own family and for your own health. And another thing which I wanted to know is if many in this audience is aware that stem cell therapy is approved in India. So when I ask this question, most of the times people say don't know, but the fact is stem cell therapy is approved in India. Basics of ulcer healing, all of us know it's a small ulcers like 1 into 1 centimeter, they heal by themselves. Whereas medium-sized ulcers, when they become big and there are some factors preventing the healing, then it doesn't heal by itself. So it will need either growth factors like PRP or scaffold, like some of the skin graft substitutes which the plastic surgeons use. Whereas very large defects, 10 into 10 centimeter, and if they are non-healing, then even a scaffold alone or growth factor alone may not be sufficient, and we will need the scaffold with stem cells, that is tissue engineering. So advances in regenerative medicine, which includes stem cells and other scaffold and growth factor, is what we are going to talk today. So this is the new technology which we are going to adopt for treating burns patients. Most of us know about platelet-rich plasma, so which is a concentrate of growth factors derived from the platelets. So today the dermatologists are using it for hair regeneration, infertility specialists, musculoskeletal pathologies are treated by orthopedic surgeons with PRP, and it is available from 2,000 rupees to now 9,000 rupees. Various kits are available. Similarly, the plastic surgeons use acellular scaffold. There are products like Dermagraft, Dermacell, which are available for treating difficult ulcers in diabetes or due to burns, and they are very costly. The acellular dermal substitutes, the scaffolds, are very costly. Even a 2 into 2 centimeter costs around 23,000 rupees. So apart from the growth factors and scaffold, stem cells are also available for treating these ulcers, difficult ulcers. So Regenerative is the mesenchymal stem cells, which is available from Cipla, which costs around 1.6 lakhs for 150 millions. Any vascular surgeon or diabetologist in India who is treating cases of non-healing ulcers can buy this and inject it into the limb for getting back angiogenesis. So this is an approved product available since 2022. So similarly, we can combine these scaffold and cells. We can combine the growth factors with stem cells. So we have done that. Regenerative and PRP we have combined and shown good results for non-healing diabetic ulcers. Similarly, scaffold plus growth factor or scaffold plus stem cells, that is what is called as tissue engineering. When we combine them, we can make tissue, that is called bioprinting. So Appligraph is a living cellular skin substitute where the scaffold is impregnated with fibroblast. So, and it costs around $870 to around $3,500 for various sizes. So if you see all these products, when difficult cases need scaffold plus stem cells, it becomes so costly and we are not able to do. So that is why we have started a project which is approved by the government of Tamil Nadu through the Tamil Nadu Chief Minister's Research Fund. They have granted us to make a skin substitute using the cadaver skin available with the skin bank at Grace Kennett Hospital, Madurai. So Grace Kennett Hospital, Madurai Kamaraj University and our Mothercell Regenerative Center, together we are trying to build skin tissue engineering for burns cases using the cadaver skin. So this is what I described earlier. We have got a grant from Tamil Nadu CM Research Fund for conducting a trial where we will use the cadaver skin provided by the Grace Kennett Hospital. The Mothercell will decellularize the cadaver skin, and it will also provide the stem cells, fibroblasts, keratinocytes and melanocytes. Madurai Kamaraj University will do the 3D printing on the scaffold, and that can be used back on patients at Grace Kennett Hospital for diabetic ulcers, burns, pressure sores which refuse to heal. There are a lot of publications, particularly platelet-rich plasma in regenerative medicine, possible applications in burns and post-burn scars. So this is now being conducted in many of the institutions, academic institutions in India, both Chandigarh PGI as well as AIIMS Delhi plastic surgery departments have conducted these trials using PRP for difficult ulcers as well as on the donor sites. What is tissue engineering or bioprinting? So it's a technology where the bio ink, which contains mainly the stem cells or the scaffold, they are mixed with the living cells and printed onto the natural construct, that is on 3D structures. Currently this technology can be used in various research areas, not only for healing the ulcers but also for drug development. There are a lot of 3D printers now available in the market. We use the term 3D printer, 3D bioprinter. 3D bioprinter means they are incorporating live cells. So like unlike regular 3D printers which use many non-living substances, you can use wax, you can use plastic in molded form. So even metal and wood 3D printers are available. But when we talk about bioprinters, they contain living cells, so they have to maintain the temperature and they have to make all the sterility aspect. All these things have to be taken care of, and it's a tough job, and that is what we are trying to do in our project. Already we know that several small objects like a ring and toys, keychains are being made with the 3D printer. So 3D printing started with these small objects, but as the science progress, now they are even building 3D printed houses. So IIT Madras has got a project where they have made a 3D printed post office. So it was around 600 square feet. So from a small, there are a lot of commercially available cell printers. I have just mentioned some of them, and we are going to use our own indigenized 3D printer for our project. So this is just one of our cases which we did 3D bioprinting inside the operation theater. So this is a diabetic patient who had a ulcer in the heel, one of the most difficult areas to heal. It refused to heal for a very long time, and then we tried 3D printing on this. This is one of the publications from Dr. Anthony Atala and team about in situ bioprinting of autologous skin cells which help in wound healing of full thickness wounds. This is the 3D printer which we used for the patient. We took this 3D printer, which is a South Korean product which is approved in India through Alchem. We took this 3D printer inside the OT. You can sterilize the machine, take it inside the OT. It's a tabletop machine, and it has got two bioinks. You can see that there are two bioinks cartridges which are available. So the red one is bioink 1, where so we place the stem cells taken from patient's abdominal fat. So plastic surgeon does a liposuction, takes stem cells from the abdominal fat, and that is placed in this cartridge. So second cartridge contains the fibrin as well as the thrombin, which the company provides. So when we take a photograph of the ulcer, and you can recreate the same ulcer by 3D printing or using this 3D printer. So here you can see the shape of the ulcer was recreated using the material from the two cartridges. One is the stem cells from the fat, and the other is the thrombin and the fibrin together forming a scaffold. And this 3D printed material of the exact size, shape and depth is placed over the ulcer site, and then dressing is done, and then it goes on to healing. It is used as a dermal patch within 30 minutes. So these are again some of the cases where this 3D printer, on the spot 3D printing technology was used. So these are some of the cases done using the 3D printing method at Bangalore by Food Secure. So similarly, we have done in our lab bone tissue engineering, like how we can do skin tissue engineering. Our initial first project was bone tissue engineering, where we have grown the osteoblasts, converting the stem cells into osteoblasts over the collagen, over beta tricalcium phosphate. So this is beta tricalcium phosphate mixed with the stem cells, and here you can see this pink color shows the stain, alkaline phosphatase stain. So again we have done with collagen and MSC, which is again converted into osteoblasts, which is proved by the staining. So this is used as a bone graft. So patients who don't have a proper healing of the bone are causing a delayed non-union or a delayed union or a chronic non-union with defect. Then in those situations, instead of taking the graft from the patient's own hip, iliac bone, we can manufacture these bone grafts in the lab, and then it can be applied over the fracture site. It can just be injected, no need to open. It can be injected using a wide bore needle, and it can help in healing of the bone. So if you want to make tissue engineering, the one technique which we have to learn is how to make spheroid cultures. So in our lab, we have made this spheroid culture using the hanging drop method. You can see on the first day, third day and fifth day, you can see the stem cells slowly assemble together, and then by fifth day they form a spheroid. When the stem cells are in the form of a spheroid, their function is exactly similar to what they do in the tissue level. Instead of having the stem cells in a 2D surface, if you have it in a 3D form as a spheroid, then the functionality is better. So to start with, it is a process of decellularization. So in our project too, what we like, how this is a decellularized organ. It's a liver, animal liver, which they have decellularized within 3 days. So they have taken the liver and then removed the cells by injecting the soap solution into the blood vessels carried into the liver. So that way you can remove all the cells and it becomes a transparent scaffold. Now it is ready to impregnate with stem cells. So when we do this decellularization and look at the microscopic picture, you can see the recreation of the exact molecular structure. The nanostructure is maintained. Whatever is the original microstructure and nanostructure is maintained by doing a decellularization. These are some of the futuristic possibilities. See, you can, somebody who has lost his nose either due to accident or some injury or a ear, so we can grow that part in the patient's own body. We can grow it on an animal, we can grow it in the lab, or we can grow it on the patient's own body, and then once it is become adequately vascularized, it can be detached and used as a skin as a replacement for the ear or replacement for the injured nose. So this is 3D printing of heart membrane. So these are all being tried throughout the world, and in the future we will be treating many diseases with 3D printing, where we can regenerate the affected organ completely, and we may avoid transplanting the organ. So this is again decellularization of the heart, perfusion. So you will be surprised to know that even we don't need an animal organ to decellularize. We can decellularize a spinach leaf. Once it is completely decellularized, by day 7 you can see that all the cells are gone and it becomes like a transparent tissue, and on this we can impregnate the cells because it has got very good the arterial venous system. So you can see this vascular pathways which can carry the nutrition also. So the leaf is a good scaffold which can be used, and we can make thin membranes, we can make sheets using that, which can be used as cardiac patch, used as kidney patch, this can be used as a liver patch. So all that is in the future possibility. Here you can see how a decellularized leaf looks after injecting the human umbilical vein cells into that, which are now incorporated into the scaffold. So this is cross kingdom tissue engineering, where, as I said, a leaf has been tissue engineered to make a tissue of our choice. So Dr. Cherian of Chennai, as I said, one of the pioneers in stem cell therapy and tissue engineering, he has done 3D printing of heart valves using a muscle patch, cardiac muscle patch, as a scaffold. So the scaffold was made at Shastra University, and stem cells from Dr. Cherian, they were used in an animal trial to create a patch for cardiac failure. Some of our cases which we have done over the years, most of them are the work of Dr. Ramachandran, our own plastic surgeon, whose lifelong work deserves a Lifetime Achievement Award, which we are proud to give him in this August occasion. So this is his case, his initial cases where in difficult ulcers which refuse to heal, we have used bone marrow aspirate concentrate. So some of these cases, just to show that it's possible to regenerate using stem cells without any major surgery, overcoming all these pathologies which cause the non-union in the first place. There is an interesting lecture by Dr. Ravi Chitoria of JIPMER, where he used to say 100 ways of treating diabetic foot ulcer. The truth that there are 100 ways itself shows that there is no one good way which can completely do the job. So by tissue engineering, probably we are aiming to complete the healing in a proper way. So like how we do the tissue engineering of the skin, the limbal stem cell transplantation can help in curing the corneal blindness. So India is one of the top countries in the world with adequate doctors who are trained in doing limbal stem cell therapy, as well as colleges, as well as the hospitals and the paramedical staff to support, who can culture the stem cells. And then this sort of treatment, where when the cornea becomes completely hazy, they can procure stem cells from the limbus, and then placing it over the affected area, they can completely regenerate the cornea. So Dr. Geeta here is here to give us a lecture on how they treat corneal burns. There are other companies in India. Pandorum Technologies is one, where they are trying to bioengineer cornea. Their project is called liquid cornea, where they are going to use a liquefied form of scaffold, which they will ultimately use the infrared or ultraviolet light to solidify the liquid form. So it is called as liquid cornea project. So before ending, I would just make it aware to all the doctors who are watching here that stem cell therapies are approved in India, and there are 7 particularly useful mesenchymal stem cells derived from bone marrow, which are approved since 2017. The first approval came in 2017, but the product came only in 2021. So the Burgess disease was the first disease for which the product was available. Stem cells from Cipla, this is how it comes in a pouch. And for osteoarthritis, the stem cells are available, allogenic bone marrow derived stem cells in a vial. This contains 25 millions of stem cells for treating a arthritis in the osteoarthritis of the knee joint, where we can regenerate the cartilage. Similarly, for skin regeneration, hair regeneration, and under eye dark circle, there are bone marrow stem cell condition medium, which are available as a product since 22. Similarly, limbal stem cell therapy was approved in 2014, and a lot of ophthalmic surgeons here have got the experience of treating corneal blindness and giving back vision to the patient using limbal stem cells. Other therapies using cells, cellular therapy, gene therapy, which are approved in India, are also mentioned in this slide. So worldwide also there are a lot of approved stem cell therapies. So people who attend this conference should go out with the knowledge that stem cell therapies are approved in India, stem cells therapies are approved throughout the world, and there are some countries where there are 3 or 4 conditions which are approved, but India tops the list with 7 therapies which are approved. The latest to join is United States of America, where they have approved the allogenic bone marrow derived stem cells. The same stem cells which is approved in India is approved for GVHD, particularly steroid resistant graft versus host disease, since 2024 December. I am just posting the approval letters. People tend to not realize that all this has happened already. So 2017, you can see the approval letter has come for thromboangiitis obliterans using stem cells. Similarly, stem cells was approved for CLI PAD 2020 and for osteoarthritis in 2022. These are approval letters given by the Drug Controller of India. Lot of specialists are already using PRP. Now PRP is a popular treatment modality. So regenerative medicine has picked up. The first step is PRP. Dermatologist, orthopedician, sports physician, plastic surgeon, vascular surgeon, diabetologist, ophthalmologist. So all these specialists, including dental surgeons, have started using PRP. And the next step is using stem cells. And we have regenerated every tissue in the body. So you can see that here we have regenerated the hair. Here we have regenerated the skin. So this is endometrium, ultrasound picture of endometrium, thin endometrium, which we have increased not only the thickness of the endometrium, but also the vascularity using stem cells. So again, this is oligospermia, where you can see after injecting of stem cells, the count of the sperm has increased, but there was also increase in the grade of motility. which is more physiological. This is mucosal regeneration in oral submucous fibrosis. Here you can see the histopathology where a grossly fibrosed and scarred mucosa has been completely regenerated with a wavy pattern of collagen and new blood vessels, proving angiogenesis. Again, this is the angiogenesis which we have shown. This is before injection in a case of thromboangiitis obliterans, and here you can see the collaterals after injection, which has saved the limb from amputation. Even neural regeneration is possible. The child who is not with severe spasticity, not able to lift the head, is able to lift the head because the spasticity comes down after stem cell injections. And Parkinson's disease today is the first neurological condition to be approved in the world. It is approved in Japan and Korea. So this is a very interesting case of melanocyte regeneration, where you can see for a case of vitiligo, we have regenerated using his own melanocytes and stem cells taken from hair follicles. We took 30 hair follicles from his occipital region and extracted the stem cells, injected, and you can see the almost near normal color reappearing after multiple doses, after 4 sessions. Post-irradiation necrosis and fibrosis are very difficult to treat, and we have treated some of them, and this is the fibrosed skin becoming almost supple and normal after injecting of stem cells. So a lot of lectures in post-irradiation and post-chemotherapy complications are also due. So how we are going to treat these difficult complications using hyperbaric oxygen as well as stem cells are going to be discussed. So thank you for listening.